esteemed judges for considering my request. And I would be reading this paper on behalf of my colleague, Dr. Priyanka, who is an excellent Uvea person. And today she could not be here because of the leave was not sanctioned. I would be reading here. So she wanted to present on epidemiology, clinical features, and treatment outcome of Fuchs uveitis syndrome in central India. As we all know that Fuchs uveitis syndrome is a chronic form of uveitis caused by mild inflammation and typically unilateral, often asymptomatic during routine examination. The diagnosis is mainly based on clinical features. However, in absence of typical features, it could be misdiagnosed and cause unnecessary corticosteroid exposure to patients. Etiological factors have been varied, and there have been multiple factors being implicated that range from genetic to infectious agents like rubella, cytomegalo, virus, toxoplasmosis, and HSV. The main complication here is the cataract development due to chronic inflammation and sometimes long-term use of steroids also. Although patients with Fuchs have a good prognosis, but incorrect diagnosis may sometimes lead to unnecessary steroids, development of cataract, and secondary glaucoma. And if there's the feature of vitreous involvement due to continuous inflammation, the surgical outcome may also be varied. And so this study was a retrospective single-center case series. We've included all consecutive patients who presented with Fuchs uveitis or who developed during follow-up. The lack of the exclusion criteria was the lack of diagnosis of Fuchs in medical records. The clinical assessment was done with detailed clinical history, examination, relevant lab investigations, and supplemented by OCT FFA wherever required. Outcome measure was improvement in BCVA. We saw that the study includes 19 eyes of 19 patients, and there was a female preponderance. The mean age was around 34 years and mean IOP around 17. The mean follow-up was done for 23 months, and the affected eye was right eye more than the left eye. The clinical characteristics, the most common presenting feature was decreased in blood vision, in addition to floaters, keratic precipitates, and other clinical signs which were seen were heterochromia, iris nodules, inflammation in the vitreous, and anterior chamber. We saw that the posterior capsular opacification was the commonest complication, and it led to mature cataracts in some cases, glaucoma, and it was managed by SICS, phacoemulsification. However, PCO was seen in around 50% of these cases. In our series, the most common age association was between 18 to 42 years, and as I earlier said, that female preponderance was seen. 20% of the cases were diagnosed as either anterior or intermediate uveitis elsewhere at the time of presentation, and 16% were diagnosed on our examination. The most common symptom was blurred vision. The most common clinical characteristic was presence of diffuse stellate keratic precipitates. After cataract surgery, PCA was noted almost in 50% of the cases. We would like to conclude by it should be a careful evaluation of such patients who present to us with blurred vision, particularly young patients, because lack of knowledge of posterior segment manifestations or absence of typical signs may lead to misdiagnosis and unnecessary exposure to steroids. Most encountered complications in Fuchs are glaucoma and cataract, hence close follow-up is required. And we require new development and new research in IOL designs for effective management of such cases. Thank you very much for giving me a patient hearing.
Thank you. Yes, most often is underdiagnosed and overtreated with steroids. It's important that we recognize this entity.
Yeah.
Thank you.
And since she's a cornea person, I think she will spare her the questions.